Well, good morning. Since late October, as we talked about on Tuesday, we've been experiencing a surge of new COVID-19 cases that has driven our positive rate and hospitalizations up significantly. Iowa is not alone. States across the country are experiencing much of the same. Since November 1st, more than 37,000 new cases have been reported at an average positivity rate of 21.8% statewide. New cases were primarily among adults, 23% among adults ages 18 to 29, 16% were among adults in their 30s, 15% were in their 40s, and 14% were in their 50s. Older adults in their 60s, 70s, and above the age of 80 accounted for a combined 20% of our new cases, and 11% of the cases were among children under the age of 18. While the highest number of new cases continues to be in our most populous counties, smaller rural counties are far exceeding them when we compare cases by population per 100,000. Since November 1st, Polk County has had the highest number of cases at 4,486, which equates to 921 cases for a population of 100,000. When you compare that to Pocahontas County, which had only 143 new cases, but which is the equivalent of 2,122 cases for a population of 100,000. We're seeing significant community spread across our entire state, both in our metro and rural communities. COVID-19 does not discriminate based on geography. The virus is present in all of our communities, and all of us can help stop its spread. Yesterday, 1,208 Iowans were in a hospital due to COVID-19, accounting for 21% of all hospitalizations statewide. While 215 COVID patients were in ICUs, another 334 ICU beds were open and available. 101 patients required the use of a ventilator, which accounts for just 25% of the ventilators that are available statewide. We continue to closely monitor hospitalizations throughout each day to ensure that resources remain stable. Recent news coverage has warned Iowans that hospital beds in some areas are full, suggesting that people may not be able to receive care. My team and DPH is in regular contact with health systems and hospital leaders, and they assure the team and me that that is not the case. While hospitals are experiencing sharp increases in patient volume due to the impact of COVID-19, they still are accepting patients. In fact, most hospitals are continuing to provide elective surgeries, although some have scaled back to open beds for more patients as needed. Reducing elective surgeries is one way to expand capacity when necessary, and hospitals are monitoring that closely on a daily basis and postponing some scheduled procedures. As we've known from the beginning, COVID-19 has the most serious impact on the health of older adults and people of any age that have pre-existing conditions, and we see that reflected in our hospitalization numbers. Older adults continue to experience more serious illness requiring hospitalization. Currently, 72% of COVID-19 hospitalized patients are age 60 and older. 23% are 60 to 69 years of age. Another 23% are age 70 to 79, and 26% are 80 or older. 12% of hospital patients are in their 50s, 7% in their 40s, 5% in their 30s, and hospitalizations are extremely low among children and younger adults. Currently, only 1% of hospital patients are under the age of 18, and another 1% are ages 18 to 29. Because of the significant increase on hospitalizations at this time, we will be updating the hospital data reported on coronavirus.iowa.gov to include the age demographics of currently confirmed COVID-19 hospitalizations. The new data will also include a breakdown of daily hospitalizations by age since July 23rd, when this data was first required to be collected and reported to the U.S. Department of Health and Human Services. The age groups will also be categorized differently, primarily by decade, with the exception of children, which will remain defined as 0 to 17 years of age. These new categories will offer more specific information, not only about hospitalizations, but new cases as well. The age group change will be applied across all data on the site where age is reported. Additionally, information is provided for hospital patients by day who had either a primary or a secondary COVID-19 diagnosis. So a primary diagnosis means that the patient's COVID-19 illness was serious enough for them to require hospitalization. A secondary diagnosis means that the patient was admitted to the hospital for a different reason, but tested positive for COVID-19. This new data is intended, again, to provide additional context to help Iowans understand more about the impact of COVID-19 and the risk to specific individuals. The current RMCC data will continue to be provided on the site as well, and the update will occur, those that I just spoke about will occur this evening. So as we discussed on Tuesday, the surge in new cases has prompted some schools to consider temporarily moving to a different learning model, whether that means moving from full-time in-person learning to a hybrid model, or requesting a waiver that allows virtual learning for a period of time. I begin to ask Director Lebo to join me today to provide a further update. Ann?
Thank you, Governor. Since Tuesday, we have received 19 waiver requests to provide primarily remote instruction, all of which were approved. A total of 43 districts and non-public schools are currently operating with a waiver, representing 9.6% of Iowa schools. All waiver requests and supporting documentation are available on our website as soon as they are processed. On Tuesday, we sent out some important reminders to superintendents about remote instruction and the waiver process, and we have scheduled a webinar for Friday to help clarify all the options available and answer any follow-up questions on the recent proclamation and the impact it may have on their school activities. To support school leaders in making the best decisions for their districts, we want to make sure we continue to make Iowa Department of Education resources and advice available in as many ways possible. Because requesting a waiver is just one option for schools, and there are many adjustments schools can make without needing additional approval from the department, we continue to encourage schools to contact us to help them work through solutions. We know that sports and activities play an important role in our schools and communities, so we are also working with districts on options that allow them to do what is best for the students and the families they serve. To our school administrators, again, if you have questions about how to do what you have determined is best for your community, please reach out to us so we can help you find the best path forward. Thank you.
Thank you, Ann. I appreciate everything you and your team are doing to help schools navigate these important decisions. So today, Test Iowa sites are back open after being closed for Veterans Day, and each site has added 200 more appointments to their daily schedules. The 5 state-operated drive-through sites can now test a combined 4,040 Iowans daily, Monday through Friday, or 20,200 each week. 1,000 appointments will be available at the Des Moines site, 840 each at the sites in Cedar Rapids, Davenport, and Waterloo, and 520 in Council Bluffs. When combined with the clinic sites and the university and college partnerships, Test Iowa has generated more than 6,000 tests a day, proving to be a valuable asset in our state's response to COVID-19. Nearly 400,000 Iowans have used Test Iowa since the first site opened on April 25th. That's 37% of all Iowans tested in our state. Over time, we've continued to increase capacity, not only at sites so we can serve more people, but also at the state hygienic lab so that more tests, which is an important component of this, can be processed more quickly with results reported in less than 24 hours at some times. Even now, there are still states that struggle with testing capacity, and we're extremely fortunate to have the strong public-private partnership with NOMI Health and our team at the State Hygienic Lab, and it's important that it continues. As you know, our contract with NOMI Health ensured the delivery of 540,000 COVID-19 test kits at a time when testing supplies were scarce and in high demand across the country. We've received all of the tests that we contracted for, and we have approximately 140,000 remaining, which we anticipate the supply will take us through December 11th. Because our contract with NOMI Health extends through April 2021, we have amended it to include the purchase of 360,000 additional sample collection kits for the Test Iowa program. The collection kits are the same that are currently used and include the swab and vial needed to collect and store samples that are transported from each site to the lab. Each kit also includes a barcode that uniquely identifies the sample and matches it to the individual tested. And this is how each sample is tracked through the entire lab process, and also what enables us to report results back to individuals electronically through the Test Iowa system. Each kit cost $9.50 for a total of $3.42 million. That equates to about $1.08 per Iowan to enable Test Iowa to continue operations while testing remains a critical component to the health of our people and our state's recovery. The PCR test, which is used at the lab to process the samples, will now be supplied by the State Hygienic Lab at a cost of $19.80 per test through the lab's existing contract, which means that the state's cost to test every Iowan that comes through a Test Iowa site is just about $29.30, and we believe that's well worth the investment. Earlier this year, when there were shortages in the testing supply chain, we contracted with NOMI Health for both the collection kit and the PCR kit for the Test Iowa program. But now that the supply chain has stabilized and strengthened, the lab can use the same type of test kit for all molecular tests, including Test Iowa, which will create even greater operational efficiencies at the State Hygienic Lab, further adding to the value of Iowa's testing strategy. On Tuesday, I announced additional mitigation measures that are now in place to help us flatten the curve and get COVID-19 to a level we can manage while continuing to move forward with life. Each of us has the ability to make a difference over the next few weeks, and I believe we all want the end of this month to look a lot different than it did when it started. And together we can make that happen, and we must. Finally, I want to congratulate Iowa's high school football teams for a season well played, especially those heading to the Dome to compete for a state title. It's always a privilege to make it this far, but never has it meant more than it does this year. The tournament provides a sense of normalcy for the athletes, coaches, and families who've worked so hard to get their teams thus far. You've had the opportunity to play, and many teams across the nation have not, so we don't want to take that for granted. I'm asking you all to do your part to practice and play safely, and for families and fans to be responsible spectators. The University of Northern Iowa and the High School Athletic Association have gone to great lengths to provide a safe environment for both players and fans, including capping capacity to better enable social distancing, requiring masks in the arena and on the concourse, and doing additional disinfection throughout. Please follow the guidelines in place at the Dome, and if you go to the local restaurant, a bar, or store afterwards, continue to practice the public health measures that will protect you and others. And while you're working hard to win your games, let's not forget that together we have an even bigger battle to win, and there's no victory more important than the one against COVID-19. So be responsible, play hard, and enjoy the opportunity. Make us all proud. And with that, I'll open it up for questions.
Governor, how are you going to address the shortage of test appointment availability? In Des Moines right now, the first test opening is on Monday or Tuesday.
Yeah, well, we
You've
have to
said
remember.
that testing is important.
Yeah, testing is important, but we have to remember that's not the only option. For example, we've tested almost 1 million Iowans, individual Iowans, but we've completed almost 2 million tests. So we have to remember that not only is there Test Iowa, there are clinics, there are doctors, and there are other entities that are providing antigen testing. So we're going to continue to make sure that we address the need, and we'll adjust like we just did, Kay. I mean, we've continued to adjust throughout this process. Originally, they had committed to being able to process 3,000. We're at 6,000 right now, and every day we're finding additional opportunities to expand that. So, we just need to continue to make people aware of where those are at.
The appointment times I was discussing were not Test Iowa. Those were alternative test sites. For example, at Hy-Vee, if you call a local doctor and try to get a test, you cannot get one if you've been exposed to a contact unless you have symptoms. And as we saw today, Ashley Henson revealed she had a COVID test, no symptoms whatsoever, and she has COVID.
Yeah. So we're when you take a look at all of the tests that we've provided and that we've actually implemented through the state of Iowa, we're in the top 20%. I think we're 8th. And so we're doing everything we can to expand that, and we will continue to do everything that we can, whether it's the Buy Next Now so we can help get those to our long-term care facilities, or whether it's opening up additional options with the clinics and our colleges and universities. So we added another 200, I think I said earlier in my remarks, to the Test Iowa site right now. And we continue to look for opportunities to streamline the processing. But, it's also, we have to look at what the capacity is at the state hygienic lab. So that's something else that we're looking at. Are there other areas that can possibly help us process some of the tests, and that would also help open up. But we've continued, I'm proud of how we've continued to expand testing, and we're not going to stop. We'll continue to look for opportunities to do that, and our team is working on it every single day on how we can meet the needs for Iowans so we can get them tested. But it's also important, Kay, that we get the turnaround time is done in a responsible manner too, because a lot of people are asymptomatic.
Governor, each week we see these, the White House Coronavirus Task Force reports. They rank states by, how many new cases they have and by their test positivity. Iowa has consistently been in the top 10 of states. And while it's true and is moving up in the rankings, while it's true that other states are having surges too, why do you believe Iowa is consistently ranked as one of the worst states?
Yeah, well, so it's ebbed and flowed. We've gone up and we've gone back down. And again, we're testing a lot of individuals. We're testing more all the time. But there just is community spread, and it's happening across the state. And so we're recognizing that. And that's why we've put in additional mitigation efforts. That's why we're doing a significant PSA campaign. That's why I've reached out to individuals to help us, spread the word and ask Iowans to step up and step in, mask up, help us control this virus. And so, we're going to continue to spread the message. We're going to continue to do everything we can. We have to, again, remember that, who's most impacted by COVID-19. So we want to focus on our vulnerable Iowans, those that are older. We want to make sure that we're staying home when we're sick, we're washing our hands often, that we're wearing a mask, we're social distancing, we're doing all of those things. And if everybody steps up and takes action to do that, eventually we're hoping that we can flatten that curve. And really, we want to make sure that we don't overwhelm our healthcare system. So we're seeing that across the state. We want to make sure that we're keeping, our businesses open, we're keeping our kids in school if we can, and we want to make sure that we are doing everything we can to protect our healthcare workforce and our first responders. And so those are the simple things that we can do that will have an impact. And you see states all across the country that are adding additional mitigation steps and taking a look at what they can do to adjust to what we're seeing in increased cases.
Governor, is there concern at all with this new details about the hospitalizations and the age groups? Is there a concern that younger people who might not be taking this as seriously, still going to bars, going to restaurants, might look at that data and say, well, someone like me isn't going to be in the hospital, so I don't need to worry about that. What is your, is that a concern? And what is your message to those younger people who are perhaps going on about life as
Yeah.
usual?
I think David kind of addressed it last on Tuesday. I mean, that's just kind of where individuals are at with how they're addressing COVID-19. But Caroline, this aligns with CDC, and so we're trying to drive consistencies and be consistent in how we report. And we've had actually individuals that have asked for us to take a look at the information that we're now providing on the website. And I've said all along, we've tried to be transparent and open and tried to provide Iowans with the data on what we're seeing happening across the state so that they can be informed and they can make decisions accordingly. But it's also why we've taken a look. We know that gatherings are driving numbers, and that's why in the new declaration that we limited the number of indoor gatherings to 25 people unless you social distance and wear a mask, and that's why we limited outdoor gatherings to 100 unless you social distance and wear a mask. We're asking, for bars, they still have to social distance. They're supposed to remain in their seat while eating and drinking, and we're limiting the number of groups to each table. So we've reduced that to 8 unless it's a household, and then they can sit together. It's why we're going to continue to get the message out there, to talk to kids and young adults on why it's important to continue to do their part to help grandma, to help a family member, to help bring the numbers down so we don't overwhelm the healthcare system and that we can keep our businesses open. They're going to have to decide, do you want the opportunity to maybe participate or to visit some of these facilities, or do you want all of that to go away? So as long as Iowans do it in a responsible manner, then we can flatten the curve, move forward until we have a vaccine, until we can improve our therapeutics. This is what everybody needs to help us move through this and achieve those simple goals that we have by doing really basic things. So we're counting on Iowans to step up and help us do the right thing.
If I may just follow up just quickly.
Well, I'm going to go to the other ones, and then if we've got time, we'll come back. So,
Governor, as more people are testing positive, what is happening with contact tracing? Do you have an increase in staff who are available to do that? What percentage of people who test positive are actually having contact tracing done?
So we have expanded the number of individuals that are doing the investigations. Actually, we will be releasing an RFP. It'll go out today that will be adding additional people. So watch for that, and we're hoping that we'll be able to bring additional contact tracing on next week. So the Department of Public Health has already brought some new additional individuals on to help with the increased positive cases. But we know, again, it's important that we get that in a timely manner. And our local public health, another thing that we've done, Kathy, is we've really automated the process. And so they now have that. And that was just, I think, released this week, if not last, but the end of last week. And that's really going to help us expedite the process so we can get it done in a quicker manner and help alleviate some of the work that our local public health individuals were doing. So I want to thank them for all the work that they're doing. But in addition to that, we'll be bringing on more people next week.
Can you tell us how many you've added recently and how many you're
I
planning
think
to bring
the
on?
number, and then I want you to verify this with the Department of Public Health because it might be more. The number that I had was 11, but I think, Kathy, it might be more than that. So I'll have somebody from DPH circle back with you and verify that. Okay.
Yeah, if I could just quickly, I just wanted to ask you a question about kind of the latest ramp up that we've seen in the activity of COVID in Iowa began probably 30 days ago. I mean, if you look at the end of September, early October, the state data would show us that's where the ramp up began, and it really took off around November 1st. I guess my question is, we really didn't hear anything from you in October as far as additional mitigation measures, and I'm wondering why you waited until Tuesday to do something new.
Well, first of all, I don't agree with your premise of the statement that you just made. It's not accurate. I actually traveled and called in to media markets all across the state. I was in Northwest Iowa. I was in Cedar Rapids. I was in Davenport. I literally called into radio stations all across the state to remind Iowans to do their part, to ask them to step up, to practice personal responsibility, to help us flatten the curve. And I'm sure Pat would be more than happy to get the AP a list of all of the radio interviews that I did, the media interviews that I did. And sometimes it's important to get into these local areas and talk directly to people. So I've spent the entire time, as I have from the very beginning, not only running the state of Iowa, but focusing on COVID-19 and the impact that that has on Iowans. But I also have to balance, as I've said over and over, the lives and livelihoods of Iowans. And so we're trying to do that every day. And I have personally reached out to Iowans throughout the state to ask them to help us do that. And I will continue to do it. And, with the PSA, it just takes time working with the Broadcasters Association, working with the various newspapers, and working with television, to put that together. So just because you've not seen it, we've been reaching out, we've been putting that together, we've been working on what that looks like, and I think newspaper ads went out this week. I believe radio has started, and TV should start next week after I get the different individuals that we're trying to bring in. That will speak to various Iowans that I think is important for Iowans to not just hear from me, but to hear from other leaders in our state on the importance of doing the right thing. Dave?
We've had people ask about on testing, and you mentioned today you're going to bump up Test Iowa capabilities here because those are in limited places, and as Kay's pointed out, it's hard to find a spot anywhere. Is there anything that you plan on doing to help with more available free testing? There are some other ones out there that might be $80, $100, $150, whatever it is. But for those who can't afford the test, do you see any additional help that they can get to get a free test?
So that's why we just, I talked about amending the contract and how we're bringing additional tests in. We didn't want to, we wanted to make sure that we had a supply chain there so we could continue to offer Iowans that opportunity. We've had a hard time finding indoor sites because, it's Iowa. And we have some pretty tough winters. And these nurses and doctors are on the outside elements trying to conduct these tests, and it's not going to work. And so we have reached out to where we're at, communities all across the state to have them help us find a facility that we could actually set up indoor Test Iowa spots, drive-throughs. And we found, some of the things that we found was an old Sears store, and it had a bay where we can drive through, and we can literally pull 3 cars in at a time, have them go through the process, lift the doors, send them out, and bring 3 more in. And it really is going to, again, expedite the process so that we think that we'll be able to increase the number of Iowans that we'll be able to test. So we're always looking at things like that. It's logistics, how we get them through, how we get them out, how we enhance the process. And I've been so proud when I think about where we started back in April and where we're at today. In a relatively short timeline, we've made a lot of progress. And I know it's important that we keep that up because of the need. And testing is a critical component to helping us address, COVID-19, helping identify who has it, who they've exposed, and how we can get to them and help, make sure that they know that and they quarantine where they can. So we're working on it, and I think the more facilities that we're able to find, we're willing to invest and help facilitate that. It's just not been as easy as we thought it would be.
Can it be as simple as, some of those other providers can do a rapid test?
Yeah.
Or 15, 20 minutes, you get one. Test Iowa is a day or two, whatever it is. Can it be as simple as providing a voucher where people can go to maybe some of these other private ones to get a free one?
That's not, we are always looking at whatever we can do. So that, we could take a look at that too.
2 more questions. Governor, there are currently outbreaks in 100 long-term care facilities.
Yep.
More than half of the deaths have been at long-term care facilities. That seems to say what's happening now isn't working. What other strategies will the state look at to help these people?
Well, every death is unfortunate. That percentage, unfortunately, has been consistent throughout, the whole time that we've been dealing with approximately with COVID-19. But so we have increased testing. For one thing, it takes 3 positives to move into outbreak status. Right now, I think on a weekly basis, they're testing all 30,000 residents weekly. We continue to test the staff as well. We continue to work with DIA, to work with the Department of Public Health, to talk about infection control and how we can do a better job of just making sure that we're using the PPE adequately. We need to make sure that our essential workers are really thinking about what they're doing when they're not at work. If you're gathering with in small groups, you're potentially exposing yourself to COVID-19. So we really need to think about, what we're doing if you're an essential worker outside of work because of where we're at with community spread. So, we continue to work with the long-term care facilities. We continue to make sure that they have the PPE that they need. We're continuing to make sure that they have access to testing because of the positivity rate that we see across the state. And so unfortunately, we are seeing that reflected in some of the numbers, but they're continuing to work on it and continuing to work with the long-term care facilities. We have a little over about 440 some, and we have I think about 100 right now that are in outbreak. But you have to remember that's 3 or more. And again, the good news about testing, as often as we are, is the fact that we are catching some of these sooner rather than later, and so we can get in front of a significant outbreak and hopefully start to, see some of the deaths and we can start to minimize some of the bad outcomes.
So it's an issue with workers and making sure they're...
Yeah, I haven't taken a question from KCCI.
Governor, Test Iowa was shut down for a day and a half this week, and if I'm correct, it'll be shut down from the Wednesday before Thanksgiving through Sunday. Given the fact that the COVID numbers are going up, is this the right thing to do?
Well, we'll take a look at that. I don't know if we've announced that yet, so I don't think that you can say that that's what we're doing. I actually asked them if they could figure out a way to keep the lab open over Veterans Day, and it just requires really a lot of logistics again. And so we're working on that right now, and hopefully we'll see what the need is and see what we have to do to meet that need. Thanks, everyone. Thank you.